The Newsday continues here on One News Now. I'm Riza Diaz. The Health Department says COVID-19 cases in Metro Manila have yet to reach its peak numbers. In today's Laging Handa briefing, Health Secretary Maria Rosario Vergere explained that the number of cases in NCR fluctuates, climbing to 8,000 cases at one point, then dipping to 5,000 cases. Vergere said the DOH continues to monitor the trends, but data shows that the COVID-19 surge in NCR has not yet peaked. This is contrary to the analysis of Octa Research Group, which said there are preliminary indications showing that the infections in the capital may have already peaked.
Meron ho tayong itinala na sa NCR na almost 8,000 cases in a day. Pagkatapos po no, nakita ho natin na nagpatuloy siya dun sa trend na 5,000 to 5,500 cases per day. Tataas, bababa, tataas, bababa. So at this point in our analysis, hindi pa ho natin nakikita na nagpipik na po tayo dito po sa mga kaso.
On that note, Professor Guido David of Octa Research Group is joining us over the phone. Sir Guido, good evening.
Hi, good evening, Riza.
Professor, what's your reaction on the Department of Health's countering Octa's preliminary projection of NCR's peak?
Well, of course, that's understandable. To be fair, what we're seeing is in its very preliminary stages. It can still change, but what we're seeing right now is, and what we said is that it may have already peaked. We're not saying it as something definite. We would like to see the trend continue for a few days. I mean, maybe for the coming days for next week. But what we're seeing right now is that the reproduction number in the NCR has decreased already. It's now around 1.22. We're projecting a further decrease today. And though I agree with USEC that cases have not yet significantly decreased. We had the record high last week. But what we're seeing is that the growth rate has decreased significantly. In fact, it's possible that we might have a negative growth rate as of today in the NCR. This would be the first time, but I haven't seen the latest data yet for the NCR. But for the Philippines, for the entire country, we have a negative growth rate, negative 2%. That means this week's number for the past 7 days is lower than last week's number. And this is the first time we've seen a negative growth rate since July.
Professor, the Department of Health also admits challenges in the submission of data. Is it possible that there are perhaps discrepancies?
I'm sorry, I didn't catch your question. Is it possible that
there could be discrepancies, Professor?
Yes. It's very possible. We are aware of that cases might actually be higher than what's being reported. But we're also looking at the trend. So even if the cases are actually higher, if the trend is starting to decrease, it should still hold. It should still be valid because we are testing a significant number of cases, and that should give us a good idea of what the trend is.
Sir, do we already have new projections amid the new quarantine system that is implemented in Metro Manila?
Well, unfortunately, Riza, because this is a new quarantine classification, or it's something new to us, we don't really have any projections right now. So unfortunately, we'll just have to wait for the next few days until we start seeing the effects of this granular approach. To be fair, what we're seeing right now until today is still a result of the recent MECQ, because what we have noticed is that it usually takes at least 2 to 3 days after before we start seeing the effects.
Sir, do you already have information perhaps on the COVID situation outside of NCR? Are there emerging COVID-19 hotspots?
Yes, actually, there are several emerging hotspots, and unfortunately, Western Visayas is starting to become a hotspot again, with cases rising in Iloilo City and in Bacolod. Um, Also, in other parts of the country, I think in Region 1, in Pangasinan and La Union, we're also seeing some increase in cases. There are a few others, I think, in Isabela, but I mean, there's actually a lot to list down. But what we're noticing is that the trends in Calabarzon, mainly in Cavite and Laguna, they have started to stabilize, meaning that we're also seeing a negative growth rate in these areas.
Finally, Professor, are there any other COVID-19 observations, like what you mentioned, trends that you would like to share with us?
Well, it's still basically the NCR that we're waiting for. We're hoping that we're right, that the cases have peaked in the NCR. But again, these trends are reversible. So that means even if we may have peaked, it can still change because the trends are really a result of what of our behavior, of what we do, and that's why it's still important to follow these health protocols, quarantine restrictions, wearing face masks, social distancing, etc. But Riza, I'm getting more optimistic. I'm becoming a bit more optimistic that we should have this under control by October, and I really think we'll have a good Christmas this time.
Certainly hope for the same thing. Thank you, as always, Professor, for sharing with us your insights and your time. That's Professor Guido David of Octa Research. Meanwhile, the Health Department reports over 23,100 fresh cases of COVID-19. The country's caseload now stands at above 2,347,000. The active case count also surged to more than 184,000. At least 255 more patients died due to the respiratory disease. Now, while over 27,000 individuals have gotten better overnight. Now, out of some 73,600 recently tested, 26% yielded positive results. The world is now scrambling to get the COVID-19 jabs, but with COVID-19 variants getting stronger, is it really a need to get a third dose of a vaccine, or what we call a booster shot? Let's watch this video from the World Health Organization.
Welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking to Dr. Catherine O'Brien today. Welcome, Catherine. Let's start with booster shots and what we know about them so far.
Well, first, I think we should distinguish what we mean when we say booster shots. What we're really talking about right now is there a need to get a third dose of a vaccine if you've already received your first 2 doses? And there are really 3 reasons why we might want to give an additional dose. The first is if you didn't respond, if you're in a category of people that didn't respond adequately to the first 2 doses that you received. We do have some information that for immunocompromised people, it may be necessary to receive a third dose because those first 2 aren't doing what they do in otherwise normal healthy people. The second reason why we might give a third dose is if over time the immunity that you received and achieved as a result of being vaccinated starts to wane, it starts to deteriorate or go down over time. And in fact, the evidence right now shows that the vaccines are holding up extremely well to protect you against severe disease, hospitalization, or even death. So we don't see strong evidence leading to a need to provide a third dose for people who have already been vaccinated. The third reason we might want to give a third dose is if the performance of the vaccines are less or inadequate against some of the variants of concern that have emerged. And again, the vaccines that we have right now against the variants, and we're watching this very carefully, are holding up extremely well. against the severe end of the disease spectrum, generally speaking, the vaccines are performing very well.
Kate, is there a scenario where certain groups of people may need this third dose of a booster shot?
Right now, we do have some evidence that there's a small proportion of people, those people who have serious immunocompromising conditions, that don't seem to respond to the first 2 doses in the way that people who don't have an immunocompromising condition do. What they need is a third dose, but that's really for their primary response. It's because they haven't adequately responded to the first 2 doses. But apart from the protection that a booster dose affords people, there are some other considerations. We need to know, does giving a third dose actually increase the immune response? And we do see evidence that that's true, and we would expect that to be true based on what we know about how vaccines work. But the other issue is, should those doses be given? As I mentioned before, the evidence is weak for making that argument. We certainly don't see conclusive evidence that a booster dose among the majority of people who have been vaccinated already is needed. And the third issue is safety. Giving a third dose needs to be monitored for the safety issues. And we would like to see a safety database before we would make any such recommendation. And that evidence is also building, but we're not there yet.
Various entrepreneurs are taking it upon themselves to reduce COVID-19 related waste while also helping those badly hit by the pandemic. Shaila Francisco tells us more.
Over 57 million COVID-19 vaccines have arrived in the country since February. And as the inoculation drive continues, boxes used as containers for these vaccines are left in warehouses. Instead of putting them to waste, entrepreneur Bon Aga sought the help of fellow businessmen and government agencies to put them to good use. The result? A housing project in Marikina City.
This house is made of 6 specialized boxes used as containers for Sinovac vaccines, and this house was just constructed in just a week. But with a volume of specialized boxes left in the warehouse, they estimate they could still construct 500 more houses.
Ruben, the beneficiary of this house, says it's one less problem for him as he lost his house during Typhoon Ulysses last year.
Maganda na bahay ko. Wala na akong masyadong problema. Hanap buhay na lang po ang kailangan.
Aga and his partners intend to build one house per month in Marikina and other places.
Kung itatapon naman natin na alam niyo naman na ang styro hindi siya biodegradable. So makakasira sa ating kalikasan to. Nagkaroon na solusyonan na yung disposal, garbage disposal, nakatulong pa tayo sa kapwa natin na bilang pabahay.
Based on data from the Environment Department, solid waste collected in Metro Manila have increased by more than 20% since the start of the pandemic. With this, various groups are coming up with ways to lessen the waste. Aling Tindera, a waste-to-cash program managed by sari-sari store owners, is available in Manila. Here, nearby residents can drop off plastic waste and then get paid for it by 2 to 13 pesos per kilo. Sari-sari store owners then segregate and compress the waste before placing them in container vans for hauling. Store owners earn 50 centavos a kilo hauled by organizers. This is a big help for Lorme, who has been earning up to 1,500 pesos per haul. This allowed her to have her own means of payment to people dropping off trash instead of depending on organizers. After this, the waste will go to vetted processing partners like cement plants for alternative fuels or to recyclers and upcyclers.
So we would like for more people to hopefully be more conscious kasi, if you're not measuring the amount of plastic that you use, you don't realize ang dami mo na palang ginagamit. But by properly segregating, by properly giving them to the right channels, nasa start natin ma-realize na, okay, ito pala, pwede kong bawasan.
For its part, the Environment Department has released an order allowing healthcare waste such as PPEs, face masks, and gloves made of woven plastic to be co-processed for alternative fuels and raw materials in cement kilns. Shaila Francisco, your One News.
Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on a Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.